I'm John from Toffee Studios, and in today's video we're going to be going through Pudding's spaying journey as well as a few updates on the herd. So first I'm just going to explain the reason why we decided to take Pudding for a spaying, and basically she'd become quite aggressive, like she'd always done that when she was in heat, but she was doing it almost all the time. And we kept noticing like patches of fur that were getting really thin, and at first we thought it was mites. We tried treating her for mites several times, but it never seemed to help. And another issue that she always had is just before she went into eat, she'd always get really bloated, and we're having to treat that every single time. So we heard that, that there is a type of ovarian cyst that can actually affect their hormones. So we started looking into that, and we saw that the only real treatment for it that actually is guaranteed to work is spaying. And as well as treating the ovarian cyst, it can prevent future problems of like cancer and things like that can crop up in the future. So we thought we'd put her in for it and get her sorted with it. So Pudding has only just turned a year old, and I thought that they needed to be older when they got these cysts, but apparently it can happen much younger than we believed, because I thought it was like 2 or 3 years old when they get them, but now I know that they can get them much younger. So it's something that you should all keep an eye out for. Now, when we originally booked with the vet, we told them that we wanted a spaying and that I wanted to speak to a vet because she is experiencing some additional problems. And they did initially say that they was going to call me back. Unfortunately, the vets were so busy that they wasn't able to call me back. So when I actually took her into the vet and I told him about that we believe that she has got ovarian cysts, he immediately looked at her when I got out of the cage and said she's definitely got it before he even touched her. Now, he said normally they'd want to do a consult beforehand and do an ultrasound or some sort of scan so that they can find out where exactly they are and what size they are, because that then dictates the type of spaying that they can do. She's had rear flank spaying, which is the better kind because it's just 2 small incisions on the back, and then that keeps it out of the way when she's peeing and pooing, so it's not on the floor, less risk of infection. But if the cysts were too big, they would have had to do an abdominal spaying and take it out that way, which does have more risk of infection because of obviously the belly's going to be touching the floor a lot more. As I said, when we first took her into the vet, he saw her sides with the loss of fur on it, and he immediately said she's definitely got cysts. And he had a good feel around her, and he said he can actually feel some small cysts in there. He said normally that they have to do an ultrasound. But because they wasn't able to contact us, he was going to do that without charging us for it, which was great for us, and we really appreciate that. But he said he needed to do it because he needed to know which type of spaying he could do, so he could see inside her basically. Right, so I'm just going to put in some footage to show you what she was like when she first came back. We couldn't film too much because she was so out of it and she was scared. But take a look at this. So as you know, as I said in a previous video, we have had Pudding spayed. We've just brought her back now. And I'm just going to show you me putting her back in, and I'll let you have a look at the scars and everything on her before I do so. So let's get this open and let's have a look at her. Oh, you can smell her, can't you? Go away. Ooh, careful. As you can see, that's one of the scars. We've had the rear flank one done, and it's easier to do it that way apparently because the ovaries are right there, so that they just cut there and they can take the ovaries straight out. Something that we have had done that not a lot of people mention is something that ours calls the laser scalpel, and we have heard it called laser therapy. And what that does is they use a laser to cauterize the wound to speed up the healing and give less chance of infection. So that should help her out. She's still very lethargic because she's still a bit over with the medication, but she will come round in a little bit. I'm just going to place her in. I know Twiggy has been desperate to see her again, so here you go. Been a few days since then. It's now Sunday and we did that on Wednesday. So I'm going to show you what she looks like now and how she's getting along. So ignore the dodgy haircut that she's got, but you can see she's got one scar here, which is where one's been taken out, and I'll just flip around and you can see the other one is just there. We also had opted for the laser recovery treatment, so what that does is it cauterises the wound to lower the chance of infection and increase the speed of the healing. So I'm just going to give her one of the medications that was prescribed for her. This one is basically Metacam, just under a different brand name, and she was also given Gappa something. Not how to pronounce it, but I'll get the name on the video. But that was like for the nerve pain. We gave her that for a few days, but she really hates it. But she doesn't seem like she's in that much pain anymore. But we are just giving her a little bit of the Metacam and some paracetamol just to help her through. As you can see on there, our vet actually put a little black mark on the syringe to tell us exactly where we needed to fill the syringe up to. So that's actually quite helpful from the vet. You're going to take it or are you going to be a pain? Not bad enough. Good girl. Good girl. Big girl. Don't you got the other one to take? You like this one? No. Don't jump off. Please. Please don't jump off. It's too high for you at the moment. I'll put you down in a minute. You like this one, see? It's a nice one. Good girl. You like this one, don't you? A bit more? So it's time for a Lumi update. She's still a little bit wheezy, as you can hear, so we are still treating her with paracetamol and bisolvon, and we are still nebulizing her. Now, Pudding has got the vets on Thursday for going for like the checkup to make sure that she's fine. So we're going to take Halloumi along with her, and we're going to get the vets to give her a quick check over as well while we're there. This is the paracetamol. You like this one? No, you're not feeling it today. Come on, this will make you feel a bit better. Oh, I know what it is. A bit more. So on a final note, we've got this little one here and we have decided to name her Ginger Cake. Now we've done it in honour of my mum, and the reason why we call it Ginger Cake is because my mum loves to bake ginger cake. It's like something that she's almost always got on hand. This would make her feel more connected to our animals. She hasn't got any of her own, but she does love animals, and she even grows lettuce for our guinea pigs, and she grows other vegetables for herself, but she often gives them some of them, like the green beans and the tomatoes. So yeah, say hello to Ginger Cake. So, one final thing is I'd like to thank every one of you for subscribing, because you've helped us hit that 1k mark. I'm not sure how many we'll have by the time this goes up, but we will be well over that 1,000 mark, so I really do thank you all for that. Really appreciate it, because that allows us to get more eyes on our shop. It allows us to produce more content like this, and you guys are clearly enjoying it, and it allows us to educate all of you. So from me, thank you for watching, and I'll see you next time.